Second.
We second it. All right, we're going to first establish quorum. Mr. Secretary, please call the roll.
Senator Carter.
Here.
Senator Nicola.
Here.
Senator Hudson.
Here.
Senator Lewis. Senator Nuremberg. Quorum is established.
All right, with quorum being established, we will now move into executive session. Can I get a second?
Second.
Thank you. I make the motion that we bring Senate Bill 1137 relating to the disclosure of vital records before the body. Can I get a second?
Second.
Thank you. Senate Bill 1137 is before the body. Is there any discussion? Seeing none, thank you. I move to do pass Senate Bill 1137. Can I get a second?
Second.
Secretary, please call the roll.
Senator Hudson.
Aye.
Senator Nicola.
Aye.
Senator Lewis.
Aye.
Senator Carter.
Aye.
Senator Nuremberg. Vote of 4-0.
With your vote of 4-0, Senate Bill 1137 is due pass. I now make a motion to bring before the body House Committee Substitute for House Bill 1696. Can I get a second?
Second.
Thank you. House Committee Substitute for House Bill 1696 is before the body. Is there any discussion? This is a Senate Committee Substitute ending in .03C. Any questions? All right. I move to adopt Senate Committee Substitute for House Committee Substitute House Bill 1696. Can I get a second?
Second.
All in favor?
Aye.
Thank you. I move to do pass Senate Committee Substitute for House Committee Substitute for House Bill 1696. Can I get a second?
Second.
Thank you. Secretary, call the roll.
Senator Hudson.
Aye.
Senator Nicola.
Aye.
Senator Lewis.
Aye.
Senator Nuremberg. Senator Carter.
Aye.
Vote of 4-0.
With your vote of 4-0, House Committee Substitute for House Bill 1696 is due passed. I now make a motion to bring House Bill 1948 related to fatherhood engagement before the body. Can I get a second?
Second.
Thank you. House Bill 1948 is before the body. Is there any discussion? Thank you. I move to do pass House Bill 1948. Can I get a second?
Second.
Thank you. Secretary, call the roll.
Senator Hudson.
Aye.
Senator Nicola.
No.
Senator Lewis.
No.
Senator Nuremberg. Senator Carter.
No.
With your vote of 1-3.
All right, by your vote of 1-3, House Bill 1948 fails to pass. And now make a motion that we go out of executive session. Can I get a second?
Second.
Thank you. We are now out of executive session. And now I am asked that we move into the public testimony portion of the committee hearing. Senator Henderson, if you would begin when you're ready. This is Senate Bill 1505.
Thank you, Madam Chairwoman, and committee members. For the record, Mike Henderson, State Senator from the 3rd Senatorial District, here to present Senate Bill 1505. Give you a little briefly. This sets up the framework for adult protection multidisciplinary teams in Missouri. These teams, made up of professionals in the aging and disabled network, come together as a coordinated team to provide wraparound services for victims of abuse, neglect, and or exploitation. MDTs provide justice and care for the older and disabled victims of abuse. A lack of coordination can lead to a duplication of efforts or no services being provided due to a fragmented service network. MDTs are our best practice for addressing abuse, neglect, or exploitation and are used in many other states. Therefore, additionally, the new federal rule ensuring access to Medicaid services requires data sharing among DHSS, DSS, and DMH to allow for a comprehensive plan to address the critical incidents and track and trends for specific providers. So what this bill does, it allows for the creation of adult protection, MDTs, as a resource for victims of abuse, neglect, and or exploitation. It assists victims by providing wraparound services from multiple service providers. It ensures justice and care for older adults and adults with disabilities who are impacted by abuse, neglect, and or exploitation. And we know more exploitation seems to be happening among some of our older adults all the time. Ensures that MDT discussions are confidential. Personally identifiable information may be shared amongst the group, but participants are prohibited from disclosing any information outside the MDT. In order for this to happen, he must establish adult protection as a resource for Missouri counties, dictate confidentiality requirements and allowances for adult protection, establish the potential members of adult protection MDT, and streamline state agency flow of information, allowing the Department of Health and Senior Services to provide full reports, including reporter information, to the Department of Mental Health to improve the investigation and tracking of incidents. The cost is neutral. There are no costs associated with this proposal. It is an administrative and legal framework. 66 Missouri counties have already expressed interest in these teams, including several that have already established them but are currently limited by information sharing barriers. And with that, I'd be happy to take any questions.
I just have a couple of questions in regards to the data that's being shared and how people opt in or opt out of what personally identifiable information is being shared.
There are probably some people are going to be able to testify, can get more into the groundwork, but I know it would not let them just share that information only with the team members and not outside the team. And the idea is they can't, I'll let them go into more details, but I know they can't share it outside the team, only with the team to try to help these adults and streamline this process.
I appreciate that. Curious if that's an opt-in to that data sharing or if they have to opt out. Anyway, those will be questions we can answer as we
Yeah,
talk
they
about
may
it
be
more.
able to answer that better.
All right. Any other questions for the Senator? Senator Lewis?
Good morning.
Good morning.
How are you?
I'm good.
Good. I just had a question. Is there like, is there a flaw in what's currently happening to help protect folks? Like why this bill?
I think the idea is to put a team that can do this in one thing instead of it being a scattergun, shotgun approach
Okay.
of trying to help some of these people. It's getting to happen more and more. How many of you gotten scam emails? You get them all the time. And who's the most vulnerable to that?
Right.
Some of our senior citizens are the most vulnerable to some of these things. And apparently, and I don't know if I was aware of this, but elder abuse has become a bigger thing over time with some of the people doing it to them. And I can see some head shaking because you probably deal with some of that, Senator, in some of the things that you deal with. But I think it's becoming more of a thing, unfortunately.
Okay, thank you.
All right. Any other questions for the Senator? Seeing none, appreciate your time. How many here are here to testify in favor of this piece of legislation? How many are here to testify in opposition? Anyone here for informational purposes? Okay, great. All right, we'll start with those who are here to testify in favor.
Good morning, Senator.
Good morning.
Good morning, Madam Chair. Good morning, members of the committee. My name is Cade Tremaine. I'm here today on behalf of the Missouri Department of Health and Senior Services, testifying in support of the bill. I've also got Mrs. Melanie Highland with me today. She is our Division Director for Senior and Disability Services, just in case there's any really in-depth programmatic questions that she might be able to more appropriately answer about how this bill would look long-term within her division. So I think that Senator Henderson really described this bill very well in the sense that this is giving us wraparound services and making sure that there is no duplication of services. We widely see this bill as making our current processes significantly more efficient, but also protecting those vulnerable individuals from things like elder abuse and financial exploitation. So those are some of the most common and constituent requests that we get specifically about financial exploitation. And I won't go too far in depth on how MDTs can be considered best practice versus the current issues that we're having. I think the best way to describe it really is things are falling through the cracks. People are not able to share information. And Senator Carter, I know you had a question about what kind of information is shared. That's something I'll let Melanie kind of touch on a little bit, and sort of the opt-in, opt-out. One of the main questions that we've gotten about this bill is, does this remove any sort of powers from the guardian? Absolutely not. A lot of times the guardian, whether it's power of attorney or otherwise, the guardian is a part of these teams, and they can get additional services from this team, additional support. So overall, I think I'll go ahead and leave it right there because, like I said, I think Senator Henderson described the bill very well, but I'm happy to answer questions.
Thank you. Does this include at all any of the public administrators or anything like that as part of the teams?
They would be considered then, and if there is a public administrator represented as guardian, then yes. And so you had asked earlier about the kind of information. Oh, for the record, Melanie Highland, Department of Health and Senior Services. You had asked about the information that would be shared. A lot of it's situational. There's HIPAA, there's protected health information, but then there's like a higher level of tier of information that cannot be shared on adult protective services allegations. And so currently our teams are trying to participate in these, but they can't even acknowledge that there was a report even made on behalf of an individual. And so as you can imagine, let's say that we are getting consistent reports filed and we know that there is something not working for this individual. They may be involved with DMH or with a community behavioral health center and receiving regular treatment and not acknowledging that there was all these crisis things. We don't know what we don't know, and we can't coordinate to try to better prevent and remediate the situation. A lot of it's just situational things. As far as you talked about opting in, a lot of the individuals that we're talking about do not have the ability to direct their own care. There sometimes is no official guardian, and so to be able to opt in would kind of minimize the impact of this. By definition, the individuals that we serve in adult protective services have to meet the eligible adult statutory definition, which is adults age 18 to 59 or 60 and above that lack the ability to basically direct their own care, to make their own decisions. So right there is kind of the threshold of where we provide APS. So.
Okay, great. I appreciate the explanation. Any other questions for the witnesses?
One more thing I'd like to add. When it comes to information sharing, of course, none of the information ever leaves the multidisciplinary team. That always stays within the team. And again, if in the sense that there is a guardian who's able to be part of the team, a lot of times they will be. There are counties in Missouri currently that have MDTs, and they feel that they are successful, but they're not as successful as they can be because of this lack of information sharing. There are 66 counties overall who have expressed extreme interest in this, and I would be willing to say that they support the bill. And Melanie, I believe you brought a couple of letters actually of support from other associations.
Correct. Phelps County is one of our longest serving MDTs and has found a real benefit from it. So I have a letter of support from the prosecuting attorney's office there, as well as their victim services group. Also, on behalf of the Office of Prosecuting Attorney for Buchanan County, I have a letter of support. Oh, that's a two-pager. As well as the Missouri Council on Aging and the Coalition for Justice for Elder and Disabled Adults that operates out of St. Louis.
Okay, I appreciate it. Great. Any questions? Seeing none? All right.
Thank you very much. Appreciate the hearing this morning. Thank you, Senator.
Do you have anything to add? I mean, you came up as an individual witness, so if you wanted to just...
No.
Okay,
If there's
perfect.
questions, this is
wanted-
a best practice. This is kind of a no-brainer. Just there's a legal limitation of the information we can share.
Perfect. All right. I think you're good to go. Thank you. Anyone else here to testify in favor? Thank you, sir. Seeing none. Anyone here to testify in opposition? Anyone here for informational purposes? Just double checking. Last call. All right. Senator, any closing comments?
No, thank you very much.
All right. Thank you. We'll now move to... I'm getting old. Representative Violet with House... There are plenty of House bills. Begin when you're ready.
Thank you, and good morning, everyone. Thank you, Madam Chair and members of the committee. My name is Terry Violet, and I'm the representative for the 104th District in St. Charles County. This bill changes statutes to allow the use of additional forms of epinephrine products in addition to the general EpiPen that most of us know about. It's an auto-injector device, such as epinephrine nasal spray and other approved products. It gives school boards authority to allow students and school nurses to use this medication in emergencies. Additionally, this bill expands the role of first responders, allowing them to administer epinephrine in any approved form to help save lives in the event of severe allergic reaction. In addition, child care centers and nursing homes are included as well. This bill will save lives for those with severe allergies. And in a moment, you'll hear from Amberly Miller. She is a lead school nurse, and she can explain anything that would be more medical than I would understand. So thank you, and I'm happy to answer any questions you'll have.
Just one quick question from me. Is this House Bill 2372 also in Representative Peters' bill?
Yes.
Okay, thank you. Just for the benefit of the committee. Any questions for Representative? Seeing none. Anyone here to testify in favor of the bill? Okay, come on up.
Good morning, Senator Carter, committee members, and Representative Violet. My name is Amberly Miller. I've been a school nurse at Carl Junction School District in Southwest Missouri for the last 20 years. For the last 3 years, I've been the lead school nurse there. I'm here today representing the Missouri Association of School Nurse Organization in support of House Bill 1826. This modifies the current statutes regarding epinephrine in schools. Food allergies can result in anaphylaxis, a life-threatening problem. Currently, in Missouri public schools, there are more than 30,000 students at risk for anaphylactic reaction while at school. Anaphylaxis is life-threatening, and for some people, particularly children, delayed or avoided treatment because of fear of injection can make that worse and lead to death. The availability of epinephrine nasal spray can reduce barriers and improve rapid treatment of anaphylaxis. The legislation modifies the current language so that schools can stock, train, and administer alternative delivery systems that are equally effective and much less invasive than the current injection that we use. Thank you for your time, and I'm happy to answer any questions. I do feel like a little bit of a subject matter expert on epinephrine in schools.
Awesome. Well, I appreciate you coming all the way from Carl Junction. I know it's a long drive.
Yeah,
So,
thank you.
Anyway, thank you for being here. Any questions for the nurse? All right. Appreciate your testimony and time.
Thank you.
All right. Anyone else here to testify in favor? Make sure you fill out a witness form and leave it on the desk, if you would.
Madam Chairman, members of the committee, my name is Kaina Iman. On behalf of the Missouri Nurses Association, we support this legislation and these treatments that are available for our students.
All right. Thank you. Any questions for the witness? Seeing none. Thank you. Next in favor?
Good morning, members of committee. I'm Robin Schulp with Kids Win Missouri. I just want to thank the representative for carrying this bill. We support it, especially the provision that allows a child care facility to be able to have one of these devices without having a child who actually has a prescription. We don't know when a very young child might have an allergy. It's never been detected. So this just gives them that safety. That's all.
All right. Any questions for the witness? Seeing none. Appreciate your time. Next in favor? Anyone else here in favor? Anyone here in opposition? Anyone here for informational purposes? All right, Representative, any closing comments? No, good, all right. So that wraps up House Bill 1826 with Representative Violet. We'll now go to House Committee Substitute for House Bill 2372 with Representative Peters.
Good morning, Madam Chair, members of the committee. For the record, Representative Tara Peters from District 122, representing Rolla and St. James, Missouri. So House Bill 2372 is a very comprehensive health care bill. A lot of legislators and senators alike have come together to put a package together that offers some great health care legislation that will offer accessibility and good health care to all of Missourians. In order to save time, I know that this is a lot of components to this. We have given you a paper that kind of breaks down everyone's legislation that's in this bill. I will highlight some, but if there are some with specific questions, we can go through that later. So basically, the bill covers everything from, we've got municipal hospital expansion of investments. We know that our rural hospitals are closing across the state. This will allow our municipal hospitals to invest to bring their bottom line up. As Representative Violet mentioned, we have epinephrine delivery devices to allow the expansion of the delivery of that system. We do have community paramedics. I would like to add a little note that there has been some discussion. There will be some language change based on the bill in front of you. We've been trying to iron the community paramedics to make a lot of people happy, and so there will be some language change to that if in fact this moves forward. That language is being considered now. We are offering doula services, which would allow a temporary waiver to CMS to allow for the expansion of doula services in the state of Missouri. It covers telehealth. It also covers limits on over-the-counter sale of drugs. We also address workplace violence in the hospitals in this bill. We offer inspections of long-term care facilities to make sure that our elderly are taken care of properly. Talks about foodborne allergies. We also, as Representative Violet also has a bill about providing placards on our license plates for persons with disabilities. We also are allowing dentistry to be practiced in our correctional centers. Licensure of wholesale drug distribution for our pharmacies. We will expand the RX Cares program for Missouri. We also cover insurance coverage of anesthetic services. It's been a topic this session of our insurance companies allowing a certain amount of time for anesthesia services. That is covered also in this healthcare legislation. Alternatives for opioid drugs, which is a huge issue for us here in the state of Missouri. This covers that. MIWA, which expands our insurance options for small businesses that are located through our Chamber of Commerce. And lastly, we also address the remote notary from a civil detention streamline of a 96-hour hold. We also, ivermectin is in this bill. We also have food as medicine in this bill. We also have a lot of other legislation that is, again, all great for Missourians. And we have a breakdown here. And again, with that, I will take any questions.
Any questions for the representative? Go ahead, Senator.
Good morning, Representative. Good to see you.
Good morning, Senator.
You got a lot in this bill.
It's a bit.
Excellent job going over it. Appreciate you gave a shout out to food as medicine there. The language, and that's something I've been working on, excited about, glad to see it on this particular vehicle. Another thing, I was looking through this and I think I saw alpha-gal. Is alpha-gal?
Yes, sorry, Representative Overcast, I did not mention alpha-gal, but
Okay.
yes, that is contained in this bill as well.
Yeah, alpha-gal is something that, it wasn't that long ago, I had no idea what it was, and now it's something that I'm hearing a lot about, especially in my district, but I'm sure it goes beyond District 33. The language that you have, the alpha-gal language, is it identical to Representative Overcast's language?
It is Representative Overcast's language, yes, sir.
Okay, and it's my understanding, I think University of Missouri and Cattlemen's and Farm Bureau, so that is the language they're supporting, is that correct?
It is, as well as American Emu Association, and then if there are any discussions about opt-in or opt-out, we do have some people here to answer those questions as well.
Good to know, good to know.
Thank you.
You, Representative. Thank you, Madam Chair.
Thank you. Just a quick question, is the opioid alternative, is that Ibogaine? Is that?
No, the alternative opioid is from the Vertex company yes. I don't think it includes Ibogaine, no.
Okay, just a quick question.
Yep.
And any other questions? Seeing none. All right. I'm imagining that most of you are here to testify in some way or fashion on this piece of legislation. Can I get a show of hands of how many are here to testify in favor? How many are here to testify for informational purposes? How many are here to testify in opposition? All right, we're going to limit testimony to 2 minutes. We'll begin with those in favor. First up.
Good morning again, Senator Carter, members, and representative. My name is Amber Lee Miller. Again, I'm the lead nurse at Carl Junction School District in Southwest Missouri. I'm here today representing the Missouri Association of School Nurses. The Missouri Association of School Nurses is in support of this bill that would modify current statutes regarding epinephrine in schools.
Thank you. Any questions for the witness? Seeing none, thank you for your testimony. Next, in favor?
Madam Chair and members of the committee, Representative Peters, thank you for introduction of this bill. My name is Brenda Rowling. I am a registered lobbyist for the Missouri Academy of Nutrition and Dietetics, and we're here to support the piece referencing the food is medicine, and that's section 208270, pages 33 and 34.
Thank you. Any questions for the witness? Seeing none, appreciate your
Thank you.
testimony. Thank you. Next, in favor?
Let's get it going. Hi, Madam Chairman, members of the committee. Kaina Iman on behalf of Missouri Nurses Association and Missouri Occupational Therapists. We support various parts of this bill: epinephrine products, doula services, telehealth, hospital workplace violence, signage, food is medicine, and some of the insurance coverage pieces.
Thank you. Any questions for the witness? Seeing none, appreciate that. Next.
Thank you, Madam Chair. Members of the committee, Justin Alferman representing SSM Health. We'd like to go on record in support of the legislation, in particular the food is medicine, the telehealth statutes. Be happy to answer any questions as they pertain to those as well.
All right. Any questions? Thank you. Next, in favor? Don't take the whole 2 minutes.
I won't, Madam Chair. Thank you. Brent Hemphill here on behalf of several clients. Missouri Ambulance Association, the provisions in there, you've passed all of them. It deals with the community paramedic. We did have a little hiccup in the last couple weeks. We've come together, and there should be some tweaks to the language to address the issue of community paramedics. It also includes language that allows for the merger of ambulance districts, which this chamber has already passed on Senate Bill 975, is over in the Senate, or over in the other chamber house. And then I also represent the Missouri Speech, Language, and Hearing Association. We have the fix for the clinical fellowship of SLPs, which is a purely technical change to allow clinical fellowships to get a licensed and do their clinical fellowship by a fully licensed SLP, regardless of where they are. And this goes into the whole transfer of license across state lines. Be happy to answer any questions.
All right. Any questions for the witness? Seeing none, thank you. Next, in favor?
Thank you, Representative. Madam Chair, members of the committee, my name is Trent Ford. I'm a registered lobbyist for the Ambulance District Association of Missouri. Here in support of the bill, I think Mr. Hemphill took most of my thunder, and thank you very much for working on that community paramedic piece of it.
Thank
That's
you.
it.
Any questions? Seeing none.
Thank you.
For your time. Next,
Thanks.
in favor?
Madam Chair and members of the committee, my name is Naomi Lopez, and I'm a senior fellow in healthcare policy with the Goldwater Institute. I'm here to offer public comments and answer any questions regarding the provision, the Hope for Missouri Patients Act, which is on page 16. This is a new pathway for individualized treatment similar to the original right to try law, which Missouri passed in 2014. You were the third state to pass it. We now have the new pathway for individualized treatments, which is very similar, offers patient protections and guardrails, informed consent. This does require an institutional review board review, and it's Missouri has an important opportunity to help lead the nation and really be the 18th state to pass this legislation nationally. I'd be happy to answer any questions.
Thank you. Any questions for the witness? Seeing none. Appreciate your time.
Madam-
You had a question for the witness?
Madam Chair, members of the committee, Organ Schlemer on behalf of Centurion for the Prison Dentist, which I think is Senator Black's bill, the RSVPs for Walmart, which I think is Senator Travis Fitzwater's bill, the 340B, the good 340B language, which I think is Senator Curtis Trent's bill, and then the subcutaneous language in there. I've testified on all these pieces before, which I think is Senator Berger's bill on behalf of Missouri Assisted Living Association.
All right. Thank you. Any questions for the witness? Seeing none. All right. Next, in favor?
Madam Chair, members of the committee, Sarah Schlemeyer here on behalf of the Missouri Center for Public Health Excellence for the public health contracting piece, the Missouri Society of Anesthesiologists for the time-limited anesthesia piece, and then the American College of OBGYNs for the doula services, the Missouri College of Emergency Physicians for the workplace violence prevention, Halion for the food as medicine, as well as the PSC prescription clarifications in there.
All right, thank you. Any questions? Seeing none. Next.
Madam Chair, members of the committee, Adam Raper here on behalf of Melville Fire Protection District. Just want to go on record in support.
All right, thank you. Next.
Madam Chair, Jackie Barget here on behalf of St. Charles County Ambulance District and the Missouri State Council of Firefighters. Really just want to say thank you to the representative and interested parties on working on some of our concerns that we had with the community paramedic language, and just wanted to make sure we were on record saying that we are good with the language that and the tweaks that are being made.
All right, thanks. Any questions? Seeing none. Appreciate it. Next in favor.
Good morning, Robin Schulp with Kids Win Missouri. Just want to go in support of the bill, specifically language related to the epinephrine delivery devices, doula services, food as medicine, and Elijah's Law, which requires licensed child care providers to adopt allergy prevention plans.
Thank you. Any questions? Seeing none. Next.
Good morning. My name is Benjamin Casterline. I'm a dermatologist at MU Healthcare and a PhD immunologist and an assistant professor at the University of Missouri School of Medicine. I'm here to speak about the Alpha-Gal bill and to say that the University of Missouri does support this bill. I think most of you know what alpha-gal syndrome is. It's a tick bite causes a lifelong allergy to mammalian meat and dairy. And mammalian meat products, which are ubiquitous, there's no proven treatment. So for many patients, that means forced veganism, basically for potentially for them and also their families, depending how sensitive they are. It's a life-changing diagnosis. Can't raise cattle, can't work in a kitchen, sometimes can't work near a kitchen, like in a school. So for children, that shapes their social life, so shapes their ability to go to school. And we have the data. We did my colleagues at MU Extension did a survey finding that the impacts of this condition extend way beyond just diet. Really significant financial, occupational, mental health consequences. I think living in Missouri, I bet most of you have heard some version of this firsthand. The question is what to do about it, and there are many possible approaches, and we can even think about a cure. And as an immunologist and a researcher, I'm really actively pursuing several different approaches. I really think we can make progress. Not every approach requires a state legislature, but I think every serious approach to helping Missourians affected by alpha-gal requires an accurate count of the burden of the disease in this state. How many are affected, where they're affected, how that's changing over time. And that is a foundational step that really requires the state government to act, not something that a physician or a researcher or even an institution like the University of Missouri can accomplish on its own. And my experience, alpha-gal syndrome patients are seeking leadership here, thanks largely to patient advocacy locally and at the national level. The federal government is beginning to act on alpha-gal syndrome, and states that can demonstrate disease burden, I think, will be positioned to benefit. Missouri is almost certainly one of the hardest hit states in the country, but without a reporting system to prove it, we risk losing the federal funding where the problem may in fact be two places where the problem may in fact be less severe. And I think that would be a missed opportunity for Missouri and the health of Missourians. And I'm happy to answer questions.
All right, thanks. Any questions for the witness? Seeing none. Appreciate your testimony. Next in favor.
My name is Ryan DeBoof. I wanted to first mention that for Jordan Valley Health, we're in support of the 340B provisions in this bill. I also wanted to take a moment. We represent the Alpha-Gal Alliance Action Fund, and this is the first time you guys have seen this language, so I apologize for disrupting the flow on an omnibus bill, but did want to take a minute to describe the bill to you. My client's top priority is legislation just like this throughout the United States that requires tracking of alpha-gal positive test results. The reason this is important is because work is also underway to flow federal funding down to states to deal with alpha-gal. And the Congress has been very clear. They want the states with high prevalence of alpha-gal to receive the bulk of that funding. If you look at a map of the United States, the CDC has done some work to determine where is the most suspected prevalence of alpha-gal. It's kind of like Appalachia and the Ozarks. Really, the hotbed is southern Missouri and northern Arkansas. And so if you look at then a map that would show what states are currently tracking alpha-gal, Missouri is the missing state. And so if we're going to receive some of the funding, we already track 116 different diseases and conditions. We'd like to get this added to the list. And it's not a theoretical issue. There is a notice of funding opportunity from the federal government. We expect it to be released at any moment for $10 million in grants for alpha-gal work. And that's just the beginning. My client is collaborating with others to seek additional federal funding to deal with the thing that I know a lot of us from the southern part of the state see very firsthand, and that is the growth of alpha-gal. Happy to answer any questions.
All right, any questions for the witness? Seeing none, appreciate your time.
Thank you.
Next in favor.
Good morning, Madam Chair and committee members. I'm Amanda Berry, Food Security Policy Manager with Empower Missouri, and I'm really here to testify in support of the Food is Medicine Act section. And I'm just going to say that food is medicine is prevention. Prevention costs less than treatment, and helping people access healthy food before illness escalates is one of the most practical ways to contain healthcare costs.
Thank you.
Happy to answer
Any
questions.
Seeing none, appreciate
Thank
your
you.
time. Make sure everybody leaves witness forms on the table. I just want a housekeeping. Nope. Go ahead.
Madam Chair, members of the committee, Michael Henderson on behalf of the Consumer Healthcare Products Association in support of the provisions relating to Sudafed purchases that came through this committee on Senate Bill 841 and Senate Bill 1069. This bill does include the language that came through the committee sub on 1069 that we worked with Senator Lewis on. So happy to answer any questions.
Thank you. Any
Thank you.
questions for the witness? Seeing
Thank
none,
you.
appreciate your testimony.
Madam Chair, members of the committee, Michael Grote appearing on behalf of Arrow Senior Living. We want to speak in support of the provisions specifically in 198.022 dealing with alternative certification of assisted living facilities. We also worked with Senator Lewis on that over a number of years, as well as others, to come up with agreed to language. So we appreciate your support of that piece.
All right, thank you. Questions? Seeing none, appreciate your time.
Good morning. My name is Adam Saunders. I work with the Columbia Center for Urban Agriculture, speaking in favor of the food is medicine parts of this bill. We do a lot of hands-on education work with people to learn how to grow food and incorporate fruits and vegetables into their diet. And there's a really good parts of this policy that partners with, through MO HealthNet, the MCOs, with local organizations to get those skill-building opportunities out there. That's really good policy.
Great, thank you. Any questions? Seeing none.
Good morning, Madam Chair and members of the committee. My name is Arib. I'm a student at St. Louis University. I'm currently skipping school today because I feel like this is pretty important.
You're on record, buddy.
Sorry, Doc. Didn't mean to skip class. I'm the leader of a public health research and advocacy organization based at St. Louis University. I was born in rural Missouri, raised in St. Louis. And kind of the main reason why I'm here is to testify in favor of this bill. I'm currently accepted to medical school, and I want to practice rural primary care, and I'm trying to make the environment as favorable as possible to let me do my job. And one of the provisions that I really want to advocate for is specifically the alternatives to opioids provision, the provision that essentially it's in the bill that it grants patients the options to have a non-opioid alternative rather than being essentially financially forced to take opioids as a first-line treatment. Essentially, in terms of physician practice, it's not really standard to give opioids when you don't need to. However, the only scenario where they are given opioids is when it is cheaper significantly than a non-opioid alternative. This bill essentially gives patients more choice for non-opioid alternatives. And so I think this is a huge win for rural Missouri, mostly because one is we all know that the opioid epidemic hits rural Missouri really, really hard. The other problem is that pain specialists and others who specialize in education management and opioid dependence management are a lot less and far in between in rural Missouri as they would be in like an urban space. So it's mostly primary care physicians who are managing opioid dependence, which gets really, really tough when your patient is sort of forced to make a decision to take an opioid as a first-line treatment. And so as such, I am testifying in favor of this bill, and I'm open to any questions.
Just a comment, we have a great medical school down in Joplin, and there's a Carl Junction nurse right over there, and we'd love to have you in rural Southwest Missouri, so just consider that. All right, any questions for the witness? Patty, Senator Lewis.
Good morning. So glad to have you here. Is this your first time testifying?
No, I think it's like my third time. Or
Okay, because I was going to say you seem like a professional, so thank you for providing testimony, and we're the state of Missouri is lucky to have you here.
Thank you so much.
Did you skip school those two other times as well?
I did. Again,
All right.
sorry, Dr. Milam.
All right, thank you for your testimony.
Thank you.
Next, in favor?
Good morning, members of the committee. Tyler Travers, registered lobbyist, here today in support of the food is medicine provisions of this bill on behalf of Canby's Markets, which is a food bank in the Kansas City region. Happy to support the provisions in this bill and Representative Jones's and Senator Hudson's, of course. I'm also here today on behalf of Missouri Appleseed in support of the doula expansion provisions of this bill. Be happy to take any questions.
Any questions? Seeing none. Thank you.
Good morning. My name is Susan Clinton. I'm a first year at St. Louis University. I'm from St. Louis, and I am also part of that healthcare policy advocacy group, which is why I'm here today. I am in favor of this bill, particularly because it expands access to doula services through Missouri HealthNet, and I think that's very important because access to doula services can decrease the cost of birth care, both for the person birthing and for Missouri HealthNet. Access to doulas also makes birthing safer, and it makes the entire process around pregnancy, birthing, and the postpartum period a lot more enjoyable, which helps patients recover. So I'm in favor of this bill.
Thank you. Any questions for the witness? Seeing none. Appreciate your testimony. Thanks for coming up. Anyone else here to testify in favor?
Chair, members of the committee, Jessica Petrie here for BJC Health, the Reach Healthcare Foundation, the National Association of Social Workers Missouri Chapter, and Feeding Missouri. Specifically in support of the provisions on public health contracting, food as medicine, the non-opioid pain access that you all have already talked about, and also want to highlight one provision I don't think anybody's talked about yet is Senator Lewis's AI mental health title protection language that came through general laws and is now included on this, sponsored by Senator Lewis and Representative Peters. This says that AI models cannot hold themselves out to be mental health professionals or advertise that they can provide those services like therapy or mental health diagnosis. This is not like a sweeping AI regulatory bill. Clearly that those run into problems. This is a very limited title protection and consumer protection piece of legislation. I can't hold myself out to be a social worker because I didn't go through the process to be licensed. And those same rules should apply to AI models as well. So it's just a truth in advertising title protection piece. Happy to take any questions, but we really appreciate you all working on this.
Thank you. Any questions? Go ahead, Senator Lewis.
And I'll just add that that individual bill went through Gen Laws and was voted out unanimously.
I remember that bill. It was a good bill. Thank you. All right, any other questions? Seeing none.
Thank you.
Thank you for your time. Next in favor?
Good morning, Madam Chair, members of the committee. Chance Epler here on behalf of the Missouri Chamber of Commerce and Industry. We just want to go on record in support of this legislation, in particular the provision relating to MIWA expansion, so multiple employer welfare arrangements, which allows small businesses here in the state of Missouri to pool their resources together to provide good, robust, quality insurance for their employees. This provision in particular expands MIWA to sole proprietors, so expands those opportunities for those individuals here in the state who are part of one of the 205 chamber federations here in the state, and then also to changes the minimum surplus requirement to a risk-based capital, which is aligned with state statute and aligned with a number of other states that do have MIWA plans as well within their states. And so, again, we're happy to go on record and support the standalone legislation passed in the House 1450, and that piece of legislation has passed the Insurance and Banking Committee over here in this chamber. It was unanimous as well, too. So happy to go on record and happy to take any questions.
You're testifying in favor of the chamber?
Yes, on behalf of the chamber, yes, ma'am.
Thanks. All right, any questions? Seeing none.
Thank you.
For your time. Next in favor? Next, going. Next, for informational purposes. Next, in opposition.
Morning, Madam Chairwoman. Finally, we get to the good part, right? I mean, come on. Hampton Williams for the Missouri Insurance Coalition. Appreciate the opportunity to speak today. There are three concerns that we have with this bill, and I think one improvement that can be made with respect to the anesthesia time language. There are some drafting issues that we have with it. One is that this is definition for anesthesia practitioner is not a defined term. For some reason, the statute's not using statutory definitions for what this profession is. The other concern we have has to do with contracting terms, and so there is a provision in the bill that prescribes this kind of moving target on how contracting contracts are determined. And then there is some other issues we have on the scope of the bill that I think was attempted to be addressed in the House. The language was, I don't think, is sufficient to address how billing is done for anesthesia service for dental offices. I provided a markup on what I think can be addressed, what could be adopted to address our concerns. Still happy to work with people on what that language is. Second issue is the non-opioid portion. The problem with the proposal is that there's no supply side obligation created. The bill compels carriers to pay for non-opioid drugs without imposing a corresponding obligation on manufacturers, wholesalers, or pharmacies to make those drugs available at a commensurate price. And so we do have language, which I've also included with the letter I'll submit here, and I'll send it to the office and the committee members, which will address that specific concern. It would adopt language which would basically say that there would be no different cost-sharing obligation if the name brand drugs are provided the same price. The other issue too is that it creates a mandate for acute care. Right now there's only one pharmacological product on the market that addresses that issue. There are other broader non-opioid alternatives available. We're again in line with the general idea that again no one should be forced to take an opioid, certainly against their will, or the doctors don't have to utilize that as a first line of defense. That's not a requirement that insurers are making. But we do have some alternative language on that as well. The doula mandate language, and there's two sections about this. One has to do with Missouri HealthNet. We have no issues with that portion. The other section has to do with 376. We oppose that. That was not ever heard in a separate hearing over in the House. I've got a list of reasons why there's problems with it. And then I do have one suggestion, I think, to improve the section on 340B, which I've included in this letter. So I will submit that for the committee's consideration and happy to work with stakeholders throughout this
We'll
process.
distribute that to the committee members.
Thank you so much.
Okay, thanks. Next in favor. Next in opposition.
Madam Chair, Shannon Cooper on
Christina, if you're
behalf
paying
of
attention there.
America's Health Insurance Plans. Always great to be in front of this committee to oppose a bill. And actually, there's a lot of great things in this bill. But unfortunately, there's three portions that we have great concern about. That would be the doula services mandate for commercial insurers, the anesthesia time issue with the new coding requirements, and then the third and final would be the belief on this opioid pain reliever that we somehow force individuals to take opioid drugs. That's not the case. Physicians can write whatever script they want. This language is put in there for a particular company. I think I've dropped some articles off to your office about that. There are other drugs in these classes. We are happy to put something in this bill that says no physician can force a patient to take an opioid drug, nor can any insurance company force you to have one. But to put language in statute that particularly benefits one company for their drug is just not the right thing to do. Be happy to answer any questions.
So similar concerns as the previous witness.
Yes.
Thank you. Any questions for the witness? Seeing none.
Thank you very much, Madam Chair.
Next in opposition.
Lisa Panett with Armorvine. There's not enough time to go over everything that's bad in this bill, and that's why you don't legislate this way. Put everything in the kitchen sink in it. 190.098 is the community paramedic services. This is a fundamental shift from paramedics providing emergency care to care in a non-emergent setting, page 13, line 8. Also, page 13, line 17, you're taking from a certified to licensed. Certification is a voluntary action taken in the private sector. License is government control and enforced. The department is going to establish regulations, which doesn't currently exist. 191.708 is MO HealthNet, not giving specific recommendations for doula services, so non-specific recommendations. So suppose protection against abortion exists in here, but you could drive a bus around that because it's non-emergent pregnancy termination is the language. Next, Planned Parenthood is now in the abortion, transitioning, and euthanasia business. And so when you have these things for the doulas, they're referring also for these abortions, transitioning, and euthanasia. You're giving the medical director in here the ability to give the order for the doulas immunity. So if they go astray, the medical director goes astray, we can't go after them civilly. 191.1146, as you are expanding telehealth, you need to ensure that this isn't used to get abortion drugs or cross-sex hormones or drugs for euthanasia. 192.020, alpha-gal should only list communicable diseases, and if you want to add on alpha-gal, you add it on separately, not open up Pandora's box to then all the data for non-communicable diseases. And I'm going to steal the Representative Haruza's statement in one of their committee hearings when he said that could be for eczema. So we should be giving opt-outs also for that portion. And like I said, I could continue on, but there's only 2 minutes.
Thank you. Any questions for the witness? Seeing none, appreciate your time. Anyone else here to testify against?
Good morning. I'm Mike Compton with ACT for Missouri. I want to go on the record opposing this bill. I would urge you, before you vote on this, to reread Article 3 of the Constitution and remember your oath. We believe this bill is unconstitutional because of all the subjects that are in it. We'd appreciate you all doing things the right way and splitting these bills up and reviewing them independently. Thank you.
Any questions for the witness? Seeing none, thank you for your time. Anyone else here to testify in opposition? Seeing none, that concludes the hearing for your bill. Any wrap-up comments?
If I may, thank you for your time. I would like to add several things in some of the opposition. One, obviously, insurance companies are not always in the best interest of patients over profits. I would like to state that. Secondly, there was language change for the authority to remain in some of the doula services. We worked with the person that submitted that to address some of that language, and obviously that will not make everyone happy. And lastly, I would like to remind as well to add that while we have some organizations here that says that this is unconstitutional, original intent is also considered when it comes to that. And this bill, again, the original intent of all of this was healthcare relation. And to say that everything wasn't vetted and addressed singularly before it was put into this massively is not correct. So I appreciate your time and thank you.
All right, that concludes the hearing for House Bill 2372. And with that, we will go to House Committee Substitute for House Bill 2355 with Representative Jones. Representative Jones, will begin when you're ready.
Thank you, Madam Chair, members of the committee. For the record, Representative Holly Jones, representing the 88th District, westernmost portion of St. Louis County. I am bringing to you something that you have absolutely never heard of. Food is medicine. Okay, just kidding, just kidding. I do know that we've talked about this a lot. The committee has heard 2 of the Senate bills on this exact thing, so I will not belabor the point. I do want to say that I have a fabulous presentation, so if you find yourself with any extra time and would like me to present this individually, just let my office know and I'd be happy to come do that. So I'm just going to give you the highlights. Food is Medicine is a program that is something that I'm so passionate about. If we can create a healthier population, our Medicaid costs and that state-funded taxpayer insurance threshold comes down, and we can use that for other places in the state where, as we know with the budget, we've got a lot of places that need money. This is one that we can definitely, over the next few years, bring those costs of Medicaid down through creating healthier environments for our population. So I'm super excited about this program. It does allow us to apply for the 1115 waiver, which we already can apply for, but for this specific program, 16 states have already done this. It's absolutely tailored towards supporting our agricultural communities, especially in rural areas where it's definitely hard to get those fresh fruits and vegetables and different things that folks need to learn a healthier lifestyle. And it allows our clinical teams, whether that's a physician, PA, NP, dietitians, all these folks that are so knowledgeable and experts in their field, to say, let's give these folks medically tailored meals to bring down their blood pressure. Maybe they've got obesity or different issues going on that would then get them healthier without so much pharmaceutical influence. So I'd be happy to take any questions. I know you've already heard some of the presentations on this, and so I'm just excited to be able to be here. So thank you for the opportunity, Madam Chair and Committee.
No, thank you for the time and thank you for presenting the bill. Any questions for the representative? All right. Testimony in favor? Begin when you're ready. Anybody here to testify in favor?
I'll step on up here. Hi, I am Katie Nixon. I am from Wheatland, Missouri, which was a 2-hour drive in the rain this morning, which was really fun. I was harvesting flowers in the dark so I could get here on time. But I'm a farmer. I grow specialty crops, which should be not necessarily called specialty crops because we all eat fruits and vegetables, which is what specialty crops are. I also am a food system activist. I work for a nonprofit called New Growth, where we work with farmers and food businesses to help them get access to new markets. I'm also the president and co-founder of the Kansas City Food Hub, where we sell whole fruits and vegetables to schools across Kansas City and other vendors. And I also am the vice president of Missouri Farmers Union, and very nervous right now, by the way. It's my first time testifying
Just take a breath, it's okay.
at a Senate committee hearing. So, and then I also had the opportunity to serve on Mark Alford's Ag Advisory Committee. So anyways, I eat, live, and breathe local food systems. Food as medicine is an emerging opportunity for farmers. We have seen mass consolidation in markets for growers, especially small farmers. It's really hard for them to scale into different places. In rural communities, it's very hard. So if we can lower the barrier for people to access these markets of food as medicine, because a lot of times it's not about necessarily access, it's about affordability and also the logistics and aggregation of getting that food organized, which is what our organization works on. So if this bill is passed, it's a long slog to actually get to a market, but our organization will be there every step of the way to make sure that there are local food markets for our growers. And I know the provision for local food is in there to preference local food, so we really appreciate that and are always working on behalf of our small farmers so that they can survive. So thank you.
Thank you. Any questions for the witness? Seeing none? Thank you. You did great. Next in favor?
Madam Chair, members of the committee, Justin Alferman representing SSM Health. We'd like to go on record in support of the legislation. Be happy to answer any questions.
Thank you. Any questions? All right.
Thank you.
Thank you. Next in favor?
Brenda Rolling, registered. I'm the registered lobbyist for the Missouri Academy of Nutrition and Dietetics to go in support of the bill. And I think one of our dietitians said it best. Food as medicine is prevention that saves money, keeps Missourians healthy, and supports Missouri farmers all at the same time.
Thank you. Any questions? Seeing none. Thank you. Next in favor?
I'm Byron Keelan with the Freedom Principle. We're here in support of this. I didn't have any prepared testimony, but our organization has worked with Representative Jones in our planning meetings and looking at the legislative session. I know she has talked about this, and we're very supportive of this. And I know she's very passionate about this, so I know she's on the right track. So appreciate that.
All right. Thank you for your testimony. Any questions? Seeing none. Anyone else here to testify in favor?
Hi, my name is Susan Clinton, and I'm still from that healthcare policy advocacy group at SLU, and I am in favor of this bill. I have a little personal story. My grandmother, she used Missouri HealthNet for decades before recently transitioning to Medicare. She was disabled during a work injury, and she was a low-income rural Missourian, and I called her. She knows I'm giving testimony on this bill, and I called her to ask if this bill would have changed her life and her health if she had access to the programs outlined within it. And she has had heart disease and kidney disease for a while now, and she said absolutely. So when she was with Missouri HealthNet, she didn't have access to programs like this, and she didn't have enough money to buy the food to keep her heart healthy, and so her heart disease worsened and contributed to her getting kidney disease. And now she and her insurance company have had to pay a lot of money because she has to have more complicated diets and complicated procedures just to keep her comfortable and active. And she and I are both in favor of this bill. We're really excited about it. It can revolutionize a lot of lives, keep a lot of people happy and active. So,
Yay, thank you. Thank you. All right, thank you. Next in favor. Can you top that?
What?
Can you top that?
No, absolutely not. I'm not even going to try. I'm just going to try to give terrible testimony in response. Jessica Petrie here for BJC Health and Feeding Missouri. Feeding Missouri is a coalition of 6 food banks serving our state. And their big mantra is food banks are constantly being asked to do more with less. And one place we're really trying to do that is around increasing the supply of healthy foods. And so programs like medically tailored groceries that help individuals get the nutrition and the right dietary makeup that they need are changing lives and preventing disease, but this is an opportunity to scale that beyond what we currently have the capacity to do. So very much appreciate everybody's work on this bill.
Thank you. Thank you for your
Thank
testimony.
you.
Next in favor. Just raise your hand if you have, so I don't have to say whatever's.
Hi, I am Billy Polanski with the Columbia Center for Urban Agriculture. I'm here to testify in support of this bill. Our organization has a number of food as medicine programs that we're doing. We work with lots of other organizations across the state who are implementing awesome programs. There's data that shows these improve people's lives, it improves their health, it saves money, and we know it because it's happening. This currently, though, it's propped up by philanthropy, which means it only happens in pockets of areas in our state. And so by having this go through Medicaid, it will enable more Missourians to have access to these types of programs and have it not rely on philanthropy. So we have some other folks who are going to testify today, and you guys heard me a couple months ago. So thank you very much. Thanks, Holly.
Thank you for your testimony. Next in favor.
Robin Shelp, Kidswood, Missouri. Want to thank the sponsor for this great bill. Just want to go in record of support for all the reasons mentioned.
Thank you. Next in favor.
Hi, my name is Mary Catherine Crook. I'm from the Columbia Farmers Market. I really appreciate the opportunity to come and support this bill. Our market, we work with farmers from all across mid-Missouri, multi-generational family farmers, small producers, and beginning farmers, all of which rely on these direct-to-consumer sales as an important part of their income. In 2025, our farmers and vendors sold over $4.2 million through our market. In addition to operating a year-round market, we administer SNAP benefits, a SNAP and a WIC matching program, and a produce prescription program, all of which increase the purchasing power for fruits and vegetables and strengthen mid-Missouri agriculture. With our multiple food access programs, we have a strong administrative framework in place for processing electronic benefits, tracking eligible purchases, reimbursing farmers, and submitting required reports, which is not unique to our market. Markets all across Missouri operate similar programs and have similar frameworks in place to make sure that programs like the produce prescription program that we have operate with dignity and efficiency and responsibility. Last year alone, all of our programs distributed over $250,000 in food benefits to our community, and over $85,000 of that was distributed to 500 individuals alone in our produce prescription program. And then that money, that $85,000, went directly into the hands of our farmers and vendors at our farmers market. So our produce prescription program is unique and remarkable in the way that it connects people living at the intersection of chronic illness and low income with fresh, local, nutrient-dense foods, and in the way that it pairs healthcare and local agriculture. Our produce prescription program is a partnership between ourselves and a local healthcare provider. And when that healthcare provider identifies a patient with a chronic illness such as diabetes or hypertension, in addition to a need for increased access to healthy food, they issue a prescription, which is then brought to our market and filled. At our market, we issue tokens that are then spent directly with the farmers, and then we kind of operate like the pharmacist in that model. So we negotiate the rates with our funders for administering the service, and we're very accustomed to working within the structured reimbursement systems that something like this would require. So we track each transaction for grant reporting and reimbursement, and then we reimburse our farmers for the tokens that are spent. Our healthcare provider has reported that the program makes patients excited and engaged in their healthcare, and participants have shared their own positive health experiences like decreased cholesterol, weight loss, being able to afford to purchase foods recommended by their doctors, and being able to supplement their federal benefits enough to afford healthy, nutrient-dense proteins like meat and eggs. They also told us of additional and unintended benefits like access to culturally important foods, more community connection, more time spent outside, and improvements to their mental health. And each one of those shoppers that has an experience like that provides a reliable revenue for each of our farmers. Our challenge that we're left with at our market is sustainability and scale. So our current program is limited to Boone County residents, restricted to one healthcare partner, and very dependent on grant funding, which often runs out before the end of the year. We consistently have a lot more interest than we do funding. So, we are extremely in support of this bill. We think that it actively engages in preventative health care while infusing Missouri agriculture with financial support. So it strengthens rural communities, supports family farms, and addresses healthcare issues in a really practical, focused way. So thank you so much for your consideration and thoughtful review.
Thank you. Would you have a minute after the committee hearing to talk?
Yeah, absolutely.
Okay,
Yeah.
questions. Right, thank you. Next in favor.
Good morning. My name is Adam Saunders with the Columbia Center for Urban Agriculture. Building on what Billy said, and good parts of this policy of supplying from local farmers, that keeps that money in the state versus going out to other states or other countries. That money circulates in our economy. But programs that we run, one, for example, is called Opportunity Gardens. So families living with low income, we go to their house, we help them set up a home kitchen garden, help them meal plan out of that garden. And that is really life-changing. Over the course of 3 years, we go to their house and help them integrate it with their kids, the family, the grandparents. The kids get excited about it. It's hard to make changes in your life, but those types of programs, community-based programs, really help lead to lifestyle change, which makes the bigger return on investment. Right now, we have funding just in little old Boone County, so try to make this across the board. Everyone eats, and so this is good policy and is heading to a way that these type of skill building opportunities are more abundant and available.
Thank you.
Thank
you for your
you.
testimony. Next in favor.
Good morning. My name's Lexi Linsman, and I'm a registered dietitian with Columbia Center for Urban Agriculture, and I am in support of this bill. I hope you will be too. I told the story last time of as a registered dietitian at St. Mary's Hospital when I saw a male patient, 22 years old, who had been admitted for his second diabetic coma in 1 month. And how, as a dietitian, you try to do nutrition counseling and provide resources through this health journey. But when I left that room, I was wondering if he'd be back for a third time. I truly believe that a bill like this would be able to give him those resources when his A1C was rising, whether it's the doctor or the dietitian he saw, that they would be able to give him money to do a produce prescription program and buy fruits and vegetables, or to, go to a cooking class so he can learn what portion sizes is and carry that throughout, or even use Columbia Center for Urban Agriculture, like Opportunity Gardens, and have a garden right there in his backyard, so when he's growing collards or tomatoes, that he can use that in his dishes, but also share it with his community members. I believe that this bill would enforce that he would have a healthy lifestyle, that he wouldn't be admitted to the hospital multiple times. He'd be able to work and feel better and live a happier life. As I'm in support of this bill, I hope you will be too. I also want to state that I am a beginning farmer. I have beef cattle and chickens and egg layers, and having this bill support local farms and get our food to Missourians would be huge for me and everyone else. Thank you.
Thank you. I appreciate your testimony. I welcome you to come back and report in a couple of years to the committee if the bill, I'm assuming, will pass. Let us know about your progress. Go ahead.
Hello again, Amanda Berry, Empower Missouri. We often think of healthcare and the economy as separate issues, but they are indeed deeply connected. As you know, diet-related conditions are one of the largest drivers of healthcare spending and lost productivity in the U.S., with total economic costs exceeding $1.1 trillion annually. And Food as Medicine offers a way to redirect some of that spending back into our local economy. The Food as Medicine programs are not just about providing food. They create a structured demand for healthy, medically appropriate food through the healthcare system, and a demand that can be met by Missouri farmers, producers, food hubs, and small businesses. When food is sourced locally, that economic impact extends beyond the initial purchase. Tufts research published that it generates between $1.32 and $1.90 in additional economic activity. This is a rare opportunity to align public health investment with economic development in a way that benefits both urban and rural communities across the state. The bill is also an opportunity to strengthen cross-sector infrastructure. Food as Medicine programs rely on coordination between healthcare providers, community-based organizations, and food producers, which create long-term capacity to address both health and economic challenges in a more integrated way. So it's not just a health policy. I look at it as it's also an economic strategy. It's supporting Missouri producers, keeping dollars local, strengthening communities, and addressing one of the root causes driving healthcare costs. So for all of these reasons, I respectfully ask you to pass the bill.
Thank you. Thank you for your testimony. Next in favor.
Long time no
back.
see you all. My name is still Arib, unless I go to a coffee shop, because then I go by Eric. That's my Starbucks name. I'm still the leader of the Public Health Research and Advocacy Organization, and
That hasn't changed in the last 5 minutes?
it has not. Again, unless I'm ordering a coffee. I'm still skipping school, and the reason why is because I actually find this bill really, really important for my future practice in rural primary care. More specifically, rural populations tend to experience more affordability barriers when it comes to affording healthy food, less primary care services, and lastly, less access to medications. I believe that this bill covers all three. In terms of access to affordable and healthy food, this bill obviously allows it so that patients can affordably access healthy food. In terms of access to primary care, it definitely takes the burden off of primary care physicians to give a script for healthy food, as opposed to medication management, which usually requires more follow-up and more comprehensive follow-up at that. And as such, I believe that this bill would actually make it a lot easier on primary care physicians. Lastly, in terms of medications, oftentimes medications are hard to access in rural Missouri. Food is a lot easier to access. And so overall, I do believe that this bill is more consistent with, obviously, prevention. It's a more effective prevention measure, and it's also more practical, especially given patients in rural Missouri and the food climate and social determinants of health that sort of affect those populations.
Thank you for your testimony.
Yeah, my pleasure.
All right. Next in favor.
Madam Chair, members of the committee, Sarah Schlemmer here to go on record in favor for House Bill 2355 on behalf of Halion and BioSTL. So Halion would like to go on record for the piece specific to the prescription micronutrient therapy. This would allow for not a supplant, but a supplement of some of the nutrient deficient diseases that we see with a micronutrient therapy, which is your multivitamins or single nutrient supplement. So this would be to combine the two efforts of healthy food and then the micronutrients as well that are needed. So happy to take any questions, but appreciate the bill sponsor for including that.
Thank you. Appreciate your testimony. Thanks. Anyone else here to testify in favor?
Madam Chair, members of the committee, I am Kelvin Simmons here on behalf of the Health Forward Foundation of Kansas City in support of this bill. I want to thank the sponsor for this bill. We have testified previously on behalf of bills that have to do with food as medicine. We're here to do that again. We'll have written testimony, and we'll also provide research papers that talk about food as medicine across the country. And so if you have any questions, happy to answer.
All right, thank you.
Thank you so much.
Anyone else here to testify in favor? Anyone here to testify for informational purposes? Anyone here to testify in opposition?
Hello. Thank you, Madam Chair, committee members, and thank you, Representative Jones, for bringing this. My name is Rachel Kylo, and I'm a physician in Jefferson County, Missouri, and I'm here with the Missouri State Medical Association to testify in opposition to a couple of components to the bill as written. There's no doubt that obesity and ultra-processed foods are the main, or one of the main drivers of disease in the United States of America and in Missouri in particular. So the fact that produce and healthy foods, nutrient-rich foods, not ultra-processed foods, would be a major prevention for obesity and obesity-related diseases is not at all up for debate. But we would like to register our opposition with two components of the bill as written. The first is the provisions regarding vitamin supplements. So if there is a true micronutrient deficiency, vitamin prescriptions for that micronutrient deficiency are actually already currently treated as prescriptions. Insurance companies cover them, et cetera.
And so what, if you don't mind me asking for clarity, so what is the opposition to it?
I'm about to get into that. So the supplement industry, though, as a whole, is extremely unregulated. So when we talk about, specific micronutrient supplements versus a supplement that claims it will help with your bone health or help with your muscle fatigue, et cetera, et cetera, et cetera. Those claims do not have to be regulated by the Food and Drug Administration, and those claims can be unproven. And in fact, some of the supplements may include materials that could be harmless or harmful and interact with patients' other current medicines. So we would suggest striking the supplement provisions from the bill and kind of separating out the supplements from the food as medicine as a whole, which we don't really have opposition to. The second thing that we'd like to bring up is the bill says prescribe all over it, but there's no mention of physicians throughout the bill. And as I mentioned, some supplements or even foods may have interactions with medications that patients are currently taking for other medical conditions. So we think that physicians should be brought in the loop in some manner. The qualified clinical team that's listed in the bill is not clearly defined as to who would be prescribing these medicines. And I would suggest either modifying that to say qualified physician-led team or qualified clinical team in conjunction with the patient's primary care physician, just to make sure that patients get the best medical care and that their physicians are not out of the loop in the equation. That's it.
Okay, thank you.
Any questions?
Any questions? Senator Lewis.
Good morning.
Morning.
We've heard this bill like 3 times, and I'm just curious. I don't recall you testifying in the previous bill hearings, did you?
I did not, no.
Okay, just like wasn't on your radar or?
Just wasn't on my radar personally yet. Mhm.
Okay, thanks.
Thank you. Anyone else here to testify in opposition?
Thank you, Madam Chair. Jacob Scott with the Missouri Association of Osteopathic Physicians and Surgeons. Also want to go on record in opposition to the bill for many of the same reasons that Dr. Kylo mentioned. Specifically, I think the supplement provisions in the bill, if we struck those from the bill, those were actually added later on, to your point, Senator Lewis. So this is kind of new language from the bills that maybe you've heard previously. Physicians are the prescribers, so we certainly want physicians to be involved with that. When you look at the language that they have in there, it looks like you just get this from a registered dietitian, so we just want to be part of the bill as well with the food provisions, and certainly would like to strike the supplement provisions. So happy to answer any questions.
Thank you for your testimony. Any questions? Right, seeing. Thank you. Anyone else here to testify in opposition? All right, Representative.
Thank you, Madam Chair. In closing, I would just like to say I do understand where the opposition is coming from. However, if we want to talk about unregulated, ultra-processed foods are highly unregulated. And clinical team, if physicians aren't included in a clinical team, that's something that would be very outlying to me. A physician absolutely would be included in the term clinical team, but not everyone has to see a physician to get a produce prescription. They may be just seeing a dietitian. They may be seeing a healthcare worker, an NP, or a APN, or a physician's assistant. So to put physician in there specifically or in conjunction with, I don't want to muddy the water and say that you have to see a physician and then the physician has to refer you to a dietitian or et cetera. So I'm in full support of how it's written, but happy to work with the committee.
Just one question now.
Sure.
Is there anything preventing somebody who is on prescription drugs to go out and eat a tomato if they wanted to?
Absolutely not. I actually recommend it.
Yeah. Okay. Thank you. Appreciate your testimony.
Thank you, Senator. Thank you, committee.